All right. Well, hey, everybody out there. Welcome to our next installment
Hey,
of our donation campaign. I'm super excited today to be joined by Dr. Dan Reidenberg from SAVE, which those of you that have been part of our tournament in the past know all too well, as he's mostly an annual speaker at event. And Dan, I think it's going on probably 15 or 16 years we've been involved together.
maybe 17 now, I think.
It's our 17th year coming up, yeah, and I know you've been there for most of them. So, as always, that's one of the biggest pieces of feedback we get after the tournament is people really enjoyed having you present and able to give some comments and really share about the work that SAVE does. So now that we're expanding this to a much larger audience this year based off of COVID, and we're not having our traditional tournament through this donation campaign, I was hoping we could maybe start with those that are not familiar with SAVE. I should share that you are the executive director of that organization. Again, we've been together for a long time. How would you, though, describe to those not familiar with SAVE what the mission of your organization is?
Well, thanks, Chad, and to Hope for doing what you're doing this year and that you've done for so many years for SAVE. SAVE is the nation's leading nonprofit organization working to prevent suicide through public awareness and education, to working to reduce stigma and shame around suicide, and to be a resource for those that have been touched by suicide. Our work really cuts across everything on the continuum of prevention to intervention and to helping those families and those communities and businesses and schools that have been impacted by suicide. So we do this in very broad strokes, and not only here in Minnesota, but we do this around the country and in fact around the world. So we're really excited about this year, and yes, it's a hard year, but an important one that we continue to get this message out that suicide is preventable.
Yeah, you touched on this a little bit, but we got together mostly because you were a very small nonprofit here in Bloomington, Minnesota, and it's been amazing to see the growth of SAVE over these last 17 years. Can you talk a little bit more about what the expansion of your organization has been, both nationally and even internationally?
Yeah, so we started out as a very local organization here in the Twin Cities, and really were that way for the first 10 years. It was all volunteer run. But our real national and international expansion came after we started expanding programming, after getting out and doing things for the federal government here, and my becoming part of the international association, the international community. But our work around public awareness is really kind of the springboard that really helped expand us beyond the Twin Cities in Minneapolis and St. Paul. We were the first to study the use of billboards and public awareness campaigns, raising awareness of the topic. And we were the first organization anywhere in the world to use public awareness campaigns to try to help the public understand suicide better, deal with some of the myths around it, and actually also deal with the losses, the grief around suicide. So our public awareness efforts really kind of help springboard us forward. Then the addition of, we developed an evidence-based program for high schools. It's called LEADS, which stands for Linking Education and Awareness of Depression and Suicide. There's only 3 evidence-based programs for schools, and we developed one of those 3. That also helped our expansion. Probably the most recent thing that we did that really kind of continued our growth and expansion was we started to form charters. These are small little offices basically around the country that are volunteers, and they come together as a group, and they are mini SAVE offices. They do the kinds of things that we do here in the Twin Cities in their local communities. So they're trained on raising awareness, on speaking, on helping families that are in distress, helping families that have suffered a loss, getting materials out. And we have charters in different cities across the country. So all of those things are the things that kind of really help expand who we are. But probably the biggest thing out of all of that, even though public awareness really put our name on the map, is social media. Our work with all the technology companies has been leading the industry around the world, and our work within what we do on social media whether it's Facebook or Twitter, Instagram, LinkedIn, any of those platforms, that has really expanded our presence both nationally and internationally.
Yeah, and that's obviously so important right now, right? People are spending more time on social media than ever. So that's critical work that you're doing there. This being our 17th year, as we talked about with the tournament, we know we've got a lot of folks that have come back to that tournament time and time again. We keep adding families that come and are part of that event. We won't be able to hold it in the same way this year. And again, we're expanding our audience to hopefully educate more people about the work that SAVE does. But, simply put, through this online donation campaign, whatever money we raise, in what ways does SAVE use those donations directly to assist what you do?
Oh, I'm happy to tell you how we use our donations. Let me start by saying that the audits that we have done every year, we are at about 92 or 93 cents of every dollar raised going right to our programs. We spend very, very little on overhead, management, and administration. Almost everything that people donate goes right back to our programs, which is unusual, actually, for most nonprofits to be that high. The dollars that are given to us both support the families that have been impacted by suicide. Your tournament has helped numbers of families get on our memorial wall. Our memorial wall is the only thing of its kind in the world to kind of remember and honor and pay tribute to those that we've lost to suicide. That wall means a lot to people, and for those families that cannot reach that $1,000 mark, this tournament really kind of helps get them there. Now, so that helps the families directly, because then their loved one's name goes on the wall, and they have this memorial in our office that helps them with their grieving process, and they share that with their family and friends. So it takes away a lot of the stigma for them around their loss. Those are operating funds for us, though, and the dollars that you give go to help creating our public awareness campaigns. Just this year, we created and launched in Chicago a brand new campaign, a brand new media campaign. It's a multimedia campaign called Today is the Day. And the whole concept behind this campaign is that we want today to be the day that somebody talks to someone, whether they talk to a friend, whether they talk to their boss, or whether they talk to a doctor. But today is the day that they start this process of getting well and getting through the mental health crisis that they're having. And obviously, today's the day we want to prevent a suicide. So some of the money goes towards our public awareness campaigns and those efforts that will not only expand those to far more outside of Chicago, radio, television, we have digital ads, and we have print ads, and we have indoor and outdoor ads that all come with that campaign. So that's part of where it goes to. Another part of where funds go to is our education. We provide education in normal times in schools. We get out to the schools and we help the schools and the kids in the schools, and we help the teachers learn about suicide prevention efforts. We train doctors, we train law enforcement, we work with the military veterans communities. So we go into those communities and we provide education and direct training. Some of those funds go towards that. That evidence-based program I told you, our LEADS program, it comes on a little CD, and it's $125, which you would think is a lot for a school. But especially in today's world, when schools are really strapped for money, we want to be able to provide that program to the schools and the kids in the schools. So some of the funds will go towards our LEADS program and getting that out to kids in schools. Another part of the funds that we separate out goes to grief and loss. We have a lot of families that contact us every day, every single day. Tragically, another family and multiple families some days contact us about a loss. So we have books, we have coping guides, we have wallet cards, we have materials that we can send out to families that are grieving across the country. And some of the funds go to help support that. So paying for those materials, paying for those things to get to those families, and providing the kind of grief support that we do. So that's a lot of where the dollars go.
Oh, that's great. Thank you for all that. You touched a little bit on the impact of COVID, and obviously we're all aware of a number of the impacts, but specifically, related to suicide, we are seeing an increase in stressors like job loss, like family isolation. Kids are getting ready to go back to school, and that's a hot topic right now based off of how different children are reacting to a distance learning environment. or maybe even just general anxiety that people are having about the pandemic in general. How has that impacted the rates of suicide that you're seeing?
Well, so the good news is that we have not seen an increase in suicides really anywhere in the country. There have been a couple of news reports that have there's been a couple of places that have said that there's more suicide attempts, but we really haven't seen that. As a matter of fact, we've seen reductions in most places. Now, and that's really good news. It's that old myth. And this is one of the things that we try to dispel in our work. Most people think that there's more suicides around the holidays, and in fact, November and December typically have the lowest numbers of suicides when people are kind of around others and they can be seen and watched. They can get the help that they need if they need it. That's what happens. We've seen a similar kind of effect with COVID, with people being around others, and even when they've been isolated, people checking in on them more. We've seen some reductions in deaths by suicide. We've also seen the advancement with the federal government allowing for telehealth and telemental health services to be provided and to be paid for is new. And that seems to have helped. Now, all that being said, and that's all pretty accurate right now, that we've seen a decrease in the number of deaths. We've seen increases among other things. The distress that COVID-19 has created, some of what you talked about, the anxiety, some of the depression, the uncertainty about the future, the financial implications, the occupational implications, the school educational implications, and not just for kids going back to school like they normally would, but those kids that are graduating and don't get to ever go back and see their friends. Those kids changing schools in between, elementary and junior high that never get to see their friends or get to say goodbye to those teachers again. Kids graduating college, going off into the world. All of those kinds of things have seen real increases in distress. So we've seen more people reporting not only depression and anxiety, but we've seen some more reports of increases in thoughts of suicide, and in a few places around the country, especially for young people, some increases in suicide attempts. Hasn't been universal, hasn't been all the way across the country. Recently, 2 weeks ago, the CDC released a new report saying that for 18 to 24-year-olds, there was a 25% increase in suicidal thinking. Well, if you really dig into that, that was not exactly true, and it was really kind of overblown in terms of the numbers. And it didn't tell us anything about the young kids. But the other thing is that it was all self-reported through an online system with no verification of what that really meant to endorse something on a survey like that. So we know from hospital admissions, we know from clinicians, we know from people contacting us in our office that thinking about suicide and attempts around suicide seem to be higher. Deaths by suicide are lower. Now, before we go on to your next question, I have to say that while that is mostly good news, some not so good news, the future is what really is concerning to me and to others that study this and do this work all the time. The longer this pandemic goes on, the longer the uncertainty that goes on, the longer unemployment stays high, or even if it gets higher, that's when we may, in fact, start seeing increases in actual deaths by suicide. So we have real serious concerns about what's going to be happening going forward. We definitely need, the country and the world needs not only a vaccine, but a treatment. Once we have a treatment, an effective treatment, that will help relieve a lot of people's anxiety because they will know that they can get treated and get through it. At least most will. Not unlike other viruses and illnesses. The vaccine will help, but it's that treatment piece that we really need to kind of calm people's nerves. And we need people to get back to their normal life, whether it is school or it is work. We need people to kind of get back into that routine. And although everybody's trying to adjust right now to life in Zoom and life online and virtually, we also know that real in-person personal interaction is critically important to our well-being. So the sooner we can get back to that, the better we're off we're all going to be in terms of mental health.